Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. Genentech has announced that the FDA has approved cetrizlimab for the treatment of adult patients with anti-aquaporin 4 antibody-positive neuromyelitis optica spectrum disorder, only the second targeted treatment for this population and the first eligible for at-home administration. Marketed under the name Enspryng, the humanized monoclonal antibody targets and inhibits interleukin-6 receptor activity, which is thought to play a key role in the inflammation observed in NMOSD. Novel recycling technology allows for a longer duration of antibody circulation, translating into a subcutaneous dosing regimen every 4 weeks after an initial loading dose. The approval pins cetrizlimab against the only other targeted treatment in this space, Alexion's eculizumab, which was approved for the same indication on June 27th of 2019. A study evaluating the cost of epilepsy surgery and surgical evaluation suggests that both the procedure and referral are cost-effective for eligible patients with drug-resistant temporal lobe epilepsy. Using a semi-Markov model to assess the cost-effectiveness of surgery and surgical evaluation over a lifetime horizon, investigators found that epilepsy surgery is cost-effective compared to medical management in surgically eligible patients by virtue of being cost-saving and more effective than management in the long run. The surgical evaluation for patients with DRTLE remains cost-effective even if the probability of being deemed a surgical candidate is as low as about 5%. Healthcare perspective costs showed that referral for surgical evaluation estimated at $423,000 a year compared to $408,000 a year for those who continued medical management. The FDA has approved viltolarsen for the treatment of patients with Duchenne muscular dystrophy amenable to exon 53 skipping, only the second FDA-approved therapy for the specific DMD gene mutation that affects 8 to 10% of patients with DMD. The agent from NS Pharma, delivered via weekly intravenous infusion, was granted accelerated approval via its priority review, fast track, orphan drug, and rare disease designations after its new drug application was accepted earlier this year. In March, NS Pharma launched its expanded access program for qualified patients. The approval was granted based on findings from the Phase 2 clinical trial and a long-term extension study, details of which were recently published in JAMA Neurology. Among 16 patients aged 4 to 9, significant drug-induced dystrophin production was observed in both viltolarsen dose cohorts, with 15 or 94% of patients achieving dystrophin levels greater than 2% of normal and 14 of 16 patients achieving levels greater than 3% of normal. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.